Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk about natural solutions for high blood pressure. So over the 30 years I've been in practice, one thing I see over and over again in patients that are in their 40s, 50s, and beyond is the majority of them come in with high blood pressure. And one thing they seem to have in common is they're on blood pressure medication. So when I check their blood pressure and their blood pressure is high, and I ask them, oh yeah, they say they're on blood pressure medication. So it's like, well, if you have hypertension and you're on medication for it, why do you still have high blood pressure? So that's one thing that is just very puzzling. And not only that, once you're on one medication for hypertension, and eventually your body adapts and it doesn't work anymore, so they give you another one, a second one, and a third one, because your body's continually adapting because you're not getting to the root cause. Well, what's causing the high blood pressure? What's causing it? Instead of just covering it up with medication and trying to force it down, what we're going to talk about is getting to the root cause and some simple solutions for lowering hypertension. So in the United States, almost 50% of Americans have high blood pressure, and just recently they came up with new guidelines. So before, hypertension was over 140 over 90, and just recently they came out with updated guidelines, 2017, that it's 130 over 80. So if it's over 130 over 80, you're considered with hypertension stage 1. And then if it's over 140 over 90, that's stage 2. So guess what? Millions more Americans now qualify to be put on medication for hypertension at 130 over 80. And you know, the usual recommendations so these are the recommendations to prevent high blood pressure. You know, eat a healthy diet, maintain a healthy weight, get enough physical activity, non-smoking, limited alcohol use. Well, if that worked, then almost 50% of Americans, 100 million, more than 100 million US adults, wouldn't have hypertension if that worked. So I'm going to talk about 3 things that can really help. And we're going to start with, well, one is diet. So there is a diet that I talked about before, a diet that I came up with called the free diet, which is a diet that's free of the most common food allergens, you know, those foods that are most responsible for inflammation, digestive, and other chronic health issues. And inflammation is behind so many chronic diseases like heart disease, cancer, hypertension, you know, on and on, fatigue, on and on. So so we're going to talk about a case, a couple different examples. So one is a patient that came in and 54 years old. So his blood pressure was 182 over 108, and he didn't, you know, he followed those guidelines to prevent hypertension. He didn't smoke, didn't really drink. He just drank alcohol very modestly. Wasn't overweight. Exercised regularly. He was in the gym, you know, 2-3 times a week, and had a pretty healthy diet. So after doing an evaluation, so he went to his primary and the cardiologist, and they said, yeah, you have to be on this high blood pressure medication and cholesterol medication. It runs in your family. No, there's no way to fix it with diet. Something you're going to have to be on the rest of your life taking this medication. But he didn't accept that because, like he said, he was a healthy guy, worked out, and just didn't want to, at the age of 54, be on medication the rest of his life. So did an evaluation, lab work. He came out with some deficiencies, nutritional deficiencies, which are one common cause of hypertension, and food reactions, food sensitivities are another common cause of inflammation and hypertension. So put them on the free diet. And if you want a copy of phase 1 of the free diet, we'd be happy to provide that with you. It's going to be posted on the link below, and you're welcome to download a copy of that. So anyway, 4 weeks into the free diet and our natural medicine formulas line of supplements, retested his labs and checked his vitals and all that. We were checking his blood pressure as he went along. So 4 weeks into it, he was 111/71, dropped. So he dropped in 4 weeks 71 points on the high, 71 points and 37. So 71 points in 4 weeks. So he's down to normal blood pressure. He dropped 7 pounds as well. And again, he wasn't really overweight at all, but he did drop 7 pounds, trimmed down a bit. And his cholesterol, as an aside, went down 34 points to 183. And most all his other lab values, he had some other things that were all improved, like low, vitamin D, magnesium, B12, and things like that were low. So between the combination of the natural medicine formulas, supplements that we recommend specifically for him because he was low in different things, and the free diet, dropped 70 points, and he was off all his medication, which was the best part of it. So diet is important, and supplements are important, but it really needs to be specific and catered, toward the individual. As a matter of fact, he had gone to a health food store before this and was taking some natural things, but it just didn't work because it wasn't specific for what he needed. And then also another thing besides diet and besides proper diet and nutritional deficiencies, third thing is structural issues, structural stress, like tension, stress to especially the neck, upper back, shoulders, can cause a lot of tension, and that can affect blood pressure. It can affect your sleep, ability to relax, cause headaches. So we had a patient come in who was 24, and he worked out regularly. He was not overweight, didn't drink that much. His diet, well, it was really terrible, but he had been improving his diet over a few months, so it wasn't that bad. And he had high blood pressure. So what happened was a couple months prior, he just started having these episodes of anxiety and high blood pressure. He ended up in the emergency room. His blood pressure was it was 200 at one point, over 200 points. Indigestion, cold hands and feet, insomnia, you wake up in the middle of the night with anxiety, panic attacks, headaches also he had. So after doing an evaluation, labs, and figuring out what was going on, again, put him on our free diet, specific natural medicine formulas. The most common ones I see related to blood pressure are that really help are vitamin D, magnesium, fish oil, multi-probiotic, and then those are the basic foundational ones, and then there's other specific ones that, depending on lab work, that are involved as well. So he also was having a lot of neck pain and low back. So after, again, evaluating, taking x-rays, he was doing treatment during this time, twice a week. We were doing some treatment, instrument adjusting muscle work, therapy. And after 4 weeks on the free diet and supplements and treatment, he had dropped, dropped 39 points in 4 weeks, and he was down to normal. He had very high blood pressure, and he had dropped, initially at 170 over 92, and that drops to 134 over 70 in 4 weeks' time. And since then, it's continued to go down even more. And a lot of most all his symptoms had cleared up as well. Sleeping well through the night, no more anxiety, the panic attacks, heart palpitations, all of that started clearing up and is better. So just to let you know, whether it's hypertension or fatigue or anxiety or whatever issues you're having, it doesn't necessarily mean you have to be on medication for this and medication for that to cover up the symptoms and not fix it. So if you're the type of person who wants to get to the root cause and really understand and find out what's going on, and then have specific solutions to get better, that is possible. You can get most any health issue cleared up. If there's a health, almost every health problem has a solution, and it's just a matter of digging and getting to the root cause and finding solutions. And you can clear these things up, like most often with like high blood pressure and fatigue and other chronic health issues you may have. So remain hopeful, it can be done. And if you have any questions on this, and just feel free to leave a comment, contact us, feel free to download a copy of the free diet phase 1 that we talked about, and look forward to seeing you next week. Thanks very much.